Are statins truly secure after all? In an era where heart disease looms as a formidable adversary to human health, statins emerge as the valiant knights in shining armor, offering hope in the battle against soaring cholesterol levels and cardiovascular risks. Yet, amidst the clamor of accolades, a shadow of doubt looms, casting uncertainty on the safety of these heralded medications, igniting fervent discussions among medical experts and patients alike. Delving into the intricate tapestry of scientific inquiry and clinical scrutiny, this article embarks on a quest to unravel the enigma surrounding the safety profile of statins, guiding us through the labyrinth of evidence to illuminate the path toward informed decision-making and optimal cardiovascular health. Having outlined the ongoing debates, it's crucial to delve into the fundamental mechanisms through which statins operate, shedding light on their efficacy and potential safety implications. The origins of statins and their mechanism of action. Statins, the vanguards of modern medicine's arsenal against cardiovascular disease, emerged as a transformative force in the late 20th century. Initially hailed as a breakthrough in cholesterol management, these medications, scientifically termed as HMG-CoA reductase inhibitors, revolutionized the landscape of preventive cardiology. At the core of their mechanism lies a meticulous orchestration of molecular interactions within the liver. Here, the enzyme HMG-CoA reductase reigns supreme, governing the intricate synthesis of cholesterol, a pivotal player in the cardiovascular narrative. With surgical precision, statins infiltrate this biochemical saga, wielding their inhibitory prowess to subdue HMG-CoA reductase, the mastermind orchestrating cholesterol production. This intervention precipitates a cascade of molecular events, culminating in a profound reduction of LDL cholesterol, the notorious harbinger of atherosclerotic peril. As the levels of LDL cholesterol plummet, so too does the ominous specter of cardiovascular calamity, as the arteries find respite from the relentless onslaught of plaque formation and arterial stenosis. Indeed, the impact of statins transcends mere lipid modulation, delving into the very fabric of cardiovascular pathophysiology. Through their virtuosic manipulation of cholesterol dynamics, these pharmacological agents bestow upon us the gift of atherosclerotic mitigation, fortifying the citadel of our cardiovascular health against the ravages of time and lifestyle indiscretions. In this intricate dance of biochemical ballet, statins emerge not merely as drugs but as sentinels of cardiovascular vigilance, standing guard against the tempests of arterial adversity, ensuring our voyage through the seas of life remains steadfast and unyielding against the tides of cardiovascular turmoil. Understanding how statins function sets the stage for exploring their proven effectiveness in reducing cardiovascular risk, a topic that has been extensively studied and documented over the years. Efficacy of statins in cardiovascular risk reduction. In the grand saga of medical exploration, the resounding chorus of evidence reverberates, heralding the profound efficacy of statins as indomitable sentinels in the realm of cardiovascular health. Across the sweeping chronicles of time, meticulous scrutiny, manifested through a myriad of clinical trials and observational odysseys, unveils the monumental impact of these pharmacological titans in quelling the tumultuous tides of cholesterol. Meta-analyses, akin to scholarly sages meticulously parsing through the annals of clinical wisdom, resoundingly affirm the transformative might of statins. These analyses orchestrate symphonies of statistical significance, heralding reductions in the dire specters of heart attacks, strokes, and cardiovascular mortality. Yet, the epic of statins transcends mere lipid modulation, unfurling a saga of multidimensional therapeutic prowess. Beyond the realms of cholesterol lowering, these agents brandish the dual swords of anti-inflammatory vigilance and plaque-stabilizing mastery. Thus, they fortify the citadel of cardiovascular well-being against the insidious incursions of atherosclerotic malfeasance. In this narrative of therapeutic triumph, statins ascend beyond the mundane realm of pharmaceutical intervention. They emerge as architects of cardiovascular resilience, deftly weaving a tapestry of cardioprotection that stands as a resolute testament to the unwavering pursuit of medical enlightenment. As we navigate the annals of medical history, let us heed the call to embrace the transformative potential of statins in safeguarding the sanctity of cardiovascular health. While the clinical benefits of statins are undeniable, it's imperative to address lingering safety concerns that have fueled skepticism and misinformation, separating myths from evidence-based realities. Addressing safety concerns. Myths versus facts. In the labyrinth of medical discourse, statins stand as a beacon of controversy amidst the tumultuous seas of cardiovascular therapeutics. Yet, within the maelstrom of skepticism lies a tapestry of evidence, meticulously woven to dispel the shadows of doubt that obscure the truth behind statin therapy. At the forefront of this battleground of perception stands the specter of statin-associated myopathy, a mythological beast purported to wreak havoc upon the musculoskeletal domain. Yet, through the lens of scientific scrutiny, this myth crumbles under the weight of empirical inquiry, revealing true statin-induced myopathy as a rare and enigmatic phenomenon, often ensnared within the labyrinthine webs of drug interactions and genetic predispositions. Similarly, the echoes of cognitive dissonance reverberate within the halls of medical lore, as tales of statin-induced cognitive impairment cast a shadow upon the landscape of neurological well-being. However, as the dust settles upon the battlefield of evidence, large-scale studies and systematic reviews emerge as stalwart defenders of truth, dismantling the myth of cognitive decline and unveiling the potential neuroprotective virtues of statins. Moreover, amidst the cacophony of fears surrounding liver integrity, clinical trials stand as sentinels of reassurance, wielding the shield of evidence against the specter of hepatotoxicity. With minimal elevations in liver enzymes and rare occurrences of clinically significant injury, the cardiovascular benefits of statins emerge as towering citadels of therapeutic efficacy, offering sanctuary to those navigating the perilous currents of cardiovascular disease. In this saga of evidence and enlightenment, the veil of controversy surrounding statins is lifted, revealing a landscape adorned with the promise of cardiovascular wellness and the triumph of scientific inquiry. With a clearer understanding of the safety profile of statins, the focus shifts towards adopting personalized strategies for prescribing and managing statin therapy, recognizing the diverse responses and individualized needs of patients. Personalized approaches to statin therapy. In the realm of cardiovascular therapeutics, the axiom of individual variability reigns supreme, casting a kaleidoscope of complexity upon the landscape of statin therapy. Recognizing the unique fingerprint of each patient's genetic makeup and lifestyle, clinicians embark upon a voyage of personalized medicine, navigating the seas of individual risk profiles and treatment aspirations. Genetic idiosyncrasies, akin to celestial constellations guiding the course of therapeutic destiny, dictate the nuanced response to statin therapy, rendering each patient a distinct entity in the symphony of cardiovascular care. Age, sex, comorbidities, and concomitant medications stand as sentinel gatekeepers, wielding their influence upon the pharmacokinetic and pharmacodynamic intricacies of statin metabolism. Moreover, in the crucible of lifestyle habits lies the alchemical potential to transmute the very fabric of therapeutic outcomes. Dietary patterns, a palimpsest of culinary indulgence, and physical activity levels, the rhythmic cadence of bodily exertion, emerge as arbiters of statin efficacy and tolerability. By harmonizing the symphony of lifestyle modifications with the pharmacological overture of statin therapy, clinicians orchestrate a magnum opus of treatment optimization, weaving a tapestry of cardiovascular wellness that transcends the confines of pharmacological intervention alone. In conclusion, the safety concerns surrounding statins have been largely exaggerated, overshadowing their substantial benefits in reducing cardiovascular risk and improving patient outcomes. By dispelling misconceptions and embracing the wealth of scientific evidence supporting their efficacy and safety, healthcare providers can empower patients to make informed decisions about statin therapy. Moving forward, a collaborative approach that integrates personalized medicine, lifestyle interventions, and evidence-based practice is essential to maximize the potential of statins in combating cardiovascular disease and promoting longevity. Join us in the journey towards knowledge and empowerment. Like, comment, and subscribe to our YouTube channel to stay updated with the latest insights, discussions, and expert opinions. Together, let's foster a community dedicated to learning and sharing valuable information. Join the conversation today.